For any joints, you should know the following topics. The topics are type of the joint, articular surface, ligaments, bursa, relations, arterial supply, nerve supply, movements, and clinical correlations. The type of shoulder joint is synovial joint, ball and socket type. So coming to articular surfaces, the joint is formed between two bones. One is scapula and another is humerus. To more specific, the glenoid cavity of scapula and head of the humerus. Now coming to the ligaments, you have to know the capsule, glenohumeral ligament, coracohumeral ligament, transverse humeral ligament, and glenoid labyrinth. The capsule of the joint is attached to the glenoid cavity of scapula and head of the humerus. For glenohumeral ligament, you have superior, inferior, and middle glenohumeral ligaments, and it attached between the humerus and glenoid cavity of scapula. The next ligament is coracohumeral ligament. It extends from the coracoid process of scapula to the greater tubercle of humerus, that is between coracoid process and humerus. Then coming to transverse humeral ligament, it bridges the bicipital groove. You have a groove in humerus, so it is called transverse humeral ligament. Before going to bursa, you have to know what is bursa. Bursa is a fluid-filled synovial sac. The key points you have to know is it is lined by a synovial membrane and it has synovial fluid. It acts as a cushion, so allow smooth movement between the adjacent structures of the joint. So coming to bursa of shoulder joint, you have to know what are the bursas. They are subscapular bursa, which lies deep to subscapularis muscle, infraspinatus bursa, that lies deep to infraspinatus muscle, and subacromial bursa, that lies between supraspinatus and coracoacromial arch. So the relations of shoulder joint, you have to know the anterior, posterior, superior, and inferior relations. Anteriorly, subscapularis muscle, short head of biceps, and coracobrachialis is related. Posteriorly, you have infraspinatus and teres minor. Superiorly, you have deltoid, coracoacromial arch, subacromial bursa, and supraspinatus. So you have to know that deltoid is a huge muscle. It have anterior fibers and posterior fibers. So anterior fibers is also related anteriorly and posterior fibers related posteriorly. Inferiorly, you have long head of triceps, axillary nerve, posterior circumflex humeral vessel. The blood supply of shoulder joint, it is supplied by anterior circumflex humeral vessel, posterior circumflex humeral vessel, subscapular vessels, and suprascapular vessels. So shoulder joint is between humerus and scapula. So obviously the blood supply is by humeral vessels and scapular vessels. So more specifically, anterior circumflex humeral, posterior circumflex humeral, subscapular, and suprascapular vessel. Now coming to the nerve supply, it is supplied by axillary nerve, musculocutaneous nerve, and suprascapular nerve. The movements of shoulder joint are flexion, extension, adduction, abduction, medial rotation, lateral rotation, and circumduction. What is circumduction? Circumduction is orderly sequence of flexion, abduction, extension, and abduction. So you have to know the main muscles which help in the following movements. For flexion, you have pectoralis major and deltoid muscle. For extension, you have deltoid and latissimus dorsi. For adduction, you have pectoralis major and latissimus dorsi. For abduction, you have deltoid and supraspinatus. For medial rotation, you have subscapularis and lateral rotation you have deltoid. The stability of the joint is provided by rotator cuff. What is rotator cuff? The tendons of subscapularis, supraspinatus, infraspinatus and teres minor around the joint capsule is called rotator cuff. What are the common issues of shoulder joint or rotator cuff tears, dislocation, in which anterior dislocation is more common, and arthritis are among the more frequent shoulder problems, are often due to overuse, injury or age related wear.